An important aspect of pain management is to understand what pain is, and defining pain is quite difficult to do for many reasons. So I'd like to focus on the definition of pain, what it is. It's an important aspect of understanding one's pain. Chronic pain is pain that persists for a period of time. Chronic pain can come in many shapes and forms, and that's what we're going to elaborate on today. Essentially, if you have pain that is persistent for a period of time, arbitrarily we use 3 months as a number. If you've got pain that persists for more than 3 months, you're likely to have chronic pain. The important aspect of chronic pain is it causes a reduction in function, and it can have some other consequential causes to the person and those around. So pain that persists is chronic, and it leads to distress. There are 2 types of chronic pain: primary chronic pain and secondary chronic pain. Primary chronic pain is pain without a known defining trigger per se. Secondary chronic pain is pain that has been caused by something, that injury, that stimulus, that factor sometimes is treated and disappears, but the pain persists. The ICD-11, the International Classification of Disease, was the first publication out of 11. The 11th edition was the first publication to include chronic pain as a disease in its own right. So it is not a symptom of something, but more a problem in its own right, which is very important for those people suffering with pain. It's very important for us as treaters of people with chronic pain because it allows us to define what we are treating. And if you have an understanding of what you're treating, you can do research on it. If we have research into things that we have defined, we can better manage it. Chronic primary pain, chronic secondary pain. So effectively, chronic primary pain is pain for 3 months or more. There is distress and functional limitations, so you're disabled in some way, and there is no better condition to account for the pain. Remember, there hasn't been a trigger for chronic primary pain. So let's talk about chronic pain versus acute pain. Acute pain happens after an injury. It happens after a surgery. It is called a nociceptive process. It is useful pain. If you break a bone, injure yourself, cut yourself, you have an appropriate reaction to that. You seek help. The nerves function normally. They send a signal to your brain. You perceive that signal as it arrives in your brain. You seek help. That pain is acute pain. It happens now. It is a symptom of a problem. Fine. Chronic pain, as I've mentioned, primary and secondary chronic pain is different. It is long-lasting. Some call it neuropathic in nature, where the nerves themselves become part of the problem. It is maladaptive and inappropriate, which means that the pain has no use to you. In other words, nothing is acutely broken, nothing is acutely damaged to seek help. Some say that chronic pain processes where the neural activity, the nerve processes, become abnormal, hypersensitized. And as mentioned before, chronic pain doesn't necessarily mean that it is a symptom of a problem that is occurring. It is its own problem. So it's not a symptom of a disorder, but its own problem. So chronic pain becomes the problem. So chronic primary pain, we've mentioned there are a number of them. Chronic widespread pain, fibromyalgia. Complex regional pain syndrome, of which there are 2 types, CRPS 1 and 2. CRPS 2 might be caused by an injury to a nerve, and again you can see how some primary pains can be triggered by other, and there is that cross overlap, which I'll come to in a little while. Chronic primary headaches and orofacial pain. migraines. Chronic migraines is a chronic pain disorder in its own right. And chronic migraines, the definition is more than 2 hours per day of headache migraines for more than 50% of a month, I believe. Chronic tension type headaches, chronic TMJ disorder, chronic burning mouth, chronic primary orofacial pain. There is no defined trigger for the pain, it occurs. Visceral pain, which is pain within the body, pain within the insides of the body, so chest, epigastric, abdomen, irritable bowel is a chronic primary pain. Chronic abdominal pain can be primary, chronic bladder pain can be primary, and of course chronic pelvic pain can be primary. In other words, there is no known discernible trigger. Chronic primary musculoskeletal pain, this is important as well. You can get pain from in the cervical region, the cervical spine, the thoracic spine, the back pain. Chronic primary back pain is a massive problem the world over. It is a massive cause of disability across the globe. And chronic primary limb pain as well. So primary pain meaning there's no discernible trigger. So on the left, chronic primary pain, which I've elaborated on each, and then on the right is the secondary pain that becomes chronic or long-lasting. There is a trigger, sometimes the trigger is treated, but the pain persists. And as you can see, there is sometimes overlap. One can lead to the other, and vice versa, so it becomes complex. Secondary pain. Let's elaborate on some of the secondary pains that we deal with, that we need to be able to define, because if we can define it, we can treat it. Cancer. Some cancer pains can become chronic. A lot of people with cancer have cancer appropriately treated nowadays, but they can continue with persistent pain. And that might be because of the cancer itself, direct effects of the cancer in the body, cancer on bone, cancer pushing on nerves. It might be due to the cancer treatment itself. So cancer chemotherapy medications can cause peripheral neuropathy. We know that radiation can cause damage to the body and trigger chronic pain. We know that surgery itself can trigger chronic pain, and that is cancer-related surgery. Post-traumatic or post-surgical pain is a massive problem, and it is by far one of the biggest areas of chronic pain that we as pain specialists see, pain that persists after surgery. And there are a number of surgeries particularly at risk of triggering chronic pain because they now have their own definition in ICD-11. Pain after amputation, phantom pain, stump pain. Pain after spinal surgery can become chronic, persistent, debilitating. Pain after thoracotomy, so that is chest surgery. Pain after breast surgery can become chronic. Pain after simple surgeries like hernia repair can become chronic. Pain after hysterectomy is a trigger for pelvic pain. And of course, pain after joint replacement, joint arthroplasty, can absolutely become chronic in some people. So that's pain after surgery. Pain after trauma. So some forms of trauma can trigger chronic pain. Burns, peripheral nerve injury, spinal cord injury, brain injury, whiplash is an injury itself that can trigger chronic pain. And pain after musculoskeletal injury, so-called people that are perhaps at work, perhaps sustain a work-related injury to the musculoskeletal system, the spine, the bones, the tendons, the muscles, the musculoskeletal system is injured in some way. That triggers chronic pain. The injury might be healed, it might be effectively treated, but the pain persists. Neuropathic pain can be chronic, and neuropathic pain is pain that comes from the nervous system, where the nervous system is affected by some disease process or injury process. These might include problems with the peripheral nervous system, so the nervous system that is not the brain or spinal cord, so the nerves in the other parts of the body. Trigeminal neuralgia, pain after peripheral nerve injury. Polyneuropathy, meaning nerves, multiple nerves that are affected. Post-herpetic neuralgia, And of course painful radiculopathy, pain that shoots down the leg. So for example, a disc prolapse injures the nerve, you get pain down the arm or leg, the disc prolapse either disappears or is effectively treated by a surgeon via microdiscectomy, but the pain continues. Chronic neuropathic pain. And then the same thing applies to the central nervous system, the brain or spinal cord. If there's an injury to the brain, a stroke, if there's an injury to the spinal cord or a disease process within the brain and spinal cord like multiple sclerosis, that can trigger chronic pain. And as you can see, this slide just shows you that there is overlap, and you can have cancer-related pain that is also chronic neuropathic pain. So for example, radiation therapy or chemotherapy. So cancer chemotherapy, you can get chemotherapy-induced painful peripheral neuropathy. It's a chronic neuropathic pain, it's a nerve problem, but it's also a cancer treatment problem. So there's a lot of overlap between some of these definitions. Chronic secondary headaches or orofacial pain is a massive discussion, and migraines, like back pain, one of the most debilitating conditions on the planet, and so you have to have an understanding as to causes of headaches, causes of migraines, causes of orofacial pains. There might be some dental causes. So for example, dental surgeries, treatments on teeth can trigger chronic pain. Dental surgery is one of the most common surgeries done because it is done by many practitioners. Many people have teeth problems, many people have dental extractions, root canals. It's a surgical procedure, and we know that roughly 1 in 5 people that have a surgical procedure can end up with chronic pain. TMJ disorders as well. So inflammation around the temporomandibular joint. These inflammation generating processes might be treated, they might settle down, but the pain persists. So let's elaborate on chronic secondary visceral pain. This is the definition, and just a couple of points I want to get across. There might be chronic pain due to a problem with the internal organs. These problems might be factors like inflammation, vascular problems, problems with the blood vessels, or mechanical factors, so pressure factors. The issue with secondary pain, and this is very important, the issue with chronic secondary pain is that, number 3 and number 4, the pain intensity might not be correlated with the disease process itself. So let's use endometriosis as an example. You might have a spot of endometriosis and be bedbound, debilitated by pain. There's no correlation. You might have high concentrations of endometriosis in multiple areas within the pelvis and sometimes even out of the pelvis and have very little pain or disability. There is no correlation. There is not necessarily a correlation between the disease process and the pain somebody experiences. And importantly, number 4, the pain may persist beyond the successful treatment of the cause. Important factor to understand, important factor to wrap your head around. So you might have an injury, it's causing pain, or it caused pain, the injury is okay now, but the pain persists. Secondary visceral pain. So I've elaborated on that. Inflammatory causes, vascular causes, mechanical causes. Chronic secondary musculoskeletal pain. There is a cause for the musculoskeletal pain. Inflammation, osteoarthritis in any joint, small or large. Spondylosis, which is degeneration within the spine and the spinal canal, can trigger secondary musculoskeletal pain. And of course, problems within the nervous system themselves can trigger musculoskeletal pain. So for example, multiple sclerosis, it's a neurological problem, but it affects the muscles, the joints, and how we move and use it, and hence can trigger secondary musculoskeletal pain. Defining chronic pain is a very important factor in initially understanding chronic pain, and if we can understand it, define it, we can better treat it.